Every year after Diwali, Delhi wakes up to a blanket of smog and silence around it. Are we becoming immune or just helpless during this condition? To understand the real health impact and what can still be done, we are joined by Dr. Vivek, Vice Chairman and Head of Pulmonology at Max Super Specialty Hospital, Saket. Welcome, Dr. Vivek.
Thank you.
So, tell us about Delhi's air quality. So, as it has plummeted once again, how severe is this current situation from a medical standpoint?
See, basically, every year around this time of the year, we find that the air quality of the Delhi, of the city per se, goes down significantly.
Yeah.
And a poor air quality, we all know, has huge health impacts. It's not just limited to the lungs per se, not just a cough, cold, bronchitis, wheezing that people do develop at this change of season, but also it can lead to certain very serious complications like lung cancer, development of interstitial lung diseases. It can also impact the heart, resulting in acute heart attacks, can impact the brain, resulting in strokes, so on and so forth. The list of complications that poor air quality can cause to our health is really very long and immense. So, and this is something that we face every year. And cumulatively, if you see, the damage is only worsening over the years that we are encountering this poor air quality. In fact, there are studies which have also shown that our lifespan, the average expected lifespan, is also reducing significantly. Some
Very true.
studies show 2 years, some show by 12 years, but that is the number that we're looking at. In fact, if you remember, there was in 2015, I think the then president of the USA, Mr. Barack Obama, was here for the Republic Day parade from 25th January to 27th January. In those 3 days, after spending very little time outside in the open, when he went back to the USA, an analysis was carried out which actually showed that the expected lifespan had been reduced by almost 6 hours. So 2 hours per day is the figure that they were looking at in reduction. And believe me, at that time, the PM 2.5 particle was only around 60, 80, while now we see PM 2.5 around 180, 190. So, the impact that poor air quality has on our health is truly immense, and especially on children. In children these days, we see lots of them developing asthma, allergies, respiratory infections quite early on in life. One of the most common causes for that also is poor air quality in Delhi NCR and the other. In fact, it's not just a problem of Delhi NCR. If you see, it's the entire Indo-Gangetic belt which is affected because of the poor air quality.
Very true. And Delhi is the most polluted city in the world. So even if we look at the stats are saying this that Delhi has become the most polluted city in the world. So last year crackers were banned in Delhi. This year crackers were allowed. So green crackers were promoted by the government. So what do you think? Was it a safe alternative? Are there really any less harm to our lungs?
See, anything that emits smoke is bound to cause harm to the lungs and to the body. So whether it is green crackers or usual crackers, even with green crackers, the percentage of harm goes down by 30-40%, but it still is. And especially those who are vulnerable, like those who already have an underlying lung disease, underlying heart disease, underlying brain disease, kidney disease, liver disease, any kind of cancers, those who are on immunosuppressive therapies, they already have low immunity. So for them, even a small trigger can be very harmful and very unsafe.
Yeah. So, what are the immediate health risks people face when AQI crosses into the severe or hazardous range?
So immediately what you will experience is cough, cold, watering from the eyes, heavy-headedness, sore throat. It's like a foreign body sensation in the throat, like something is stuck, and followed by breathlessness, wheezing, chest tightness. Especially those people who already have an underlying lung disease, they would feel worsening of their symptoms. And of course, it could even progress to respiratory failure, landing the patient up in the ICU. Acute increases in acute increases in PM 2.5 particles have also been associated with acute heart attacks. There was a study which was carried out that beyond a particular limit of PM 2.5 levels, if they continue, then there could be an increased incidence of patients getting admitted to the hospital with acute exacerbation of bronchial asthma, acute exacerbation of chronic obstructive pulmonary diseases, and also acute myocardial infarction, that is acute heart attacks.
Yeah. So, which groups are the most vulnerable during such pollution spikes? Children, elderly, or those with pre existing conditions?
Absolutely. So these are the three main groups which are majorly affected. Children less than 5 years, elderly more than 65 years, and those with an underlying chronic lung disease, heart disease, kidney disease, any disease, or those who are on steroids for any other ailment, those who are on anti-cancer therapies, who are whose immunity is low. Because what happens is that air pollution results in an inflammation in the lungs. So because of that inflammatory cascade that is ongoing, that reduces the immune response to the various viruses and bacteria and fungi which are there in the air. So you become more prone. So already you have a low immune status because of your underlying lung condition or heart condition or kidney condition. On top of that, your entire defense mechanism, the immune system, is focused on in tackling the air pollution. So
Yeah.
that weakens the defense mechanisms, and therefore the secondary bacterial, viral, fungal infections, they become more common. And also this time of the year, the flu is also very common. So that worsens the situation. It's like a double whammy kind of a situation.
Yeah. So, have you noticed a visible rise in respiratory or cardiac cases at the hospital since post Diwali smog set in?
See, it's too early to say that because post Diwali people also take some time to recuperate. Not as many people are there in town, so I wouldn't say that there's a sudden spike in the number of patients coming to the hospital. But I'd certainly say that whoever is coming these days is definitely coming and saying that ever since Diwali, our cough, cold, breathlessness has increased. So definitely the impact is quite visible.
Yeah. So, what level of AQI can still be considered safe for human health?
Hmm. So that you'll have to go by the WHO standards, which say that up to 50 AQI level is normal. 50 to 100 becomes unsafe. And then, depending on the brackets, 100 to 200, 200 to 300, and then 300 to 400, they're all very unsafe limits. Basically,
Hmm.
what you need to remember is that if the AQI level is 400 and above, then nobody should be moving out. You should be restricting your physical out. I mean, so you should be restricting your outdoor physical activity to bare minimum as much as possible. If it is between 300 and 400, then people who are healthy, normally healthy people, they could venture out but not be doing strenuous physical activities outdoors. Between 200 to 300, all those people who fall in the vulnerable group, they should be avoiding any kind of strenuous physical activity outdoors completely. So less than 200 is the time where you can just be safely around. But yes, what we need to do is that we need to go away from our morning walks, the no exercising outdoors, minimize our outdoor movement, stay indoor, and keep the indoors also clean. That's also equally important.
Yeah. So, what simple yet effective steps can residents take to protect themselves on high pollution days? Are these the
So
only thing, or they can be using air purifiers or other things, or eating something or drinking something so that they can protect themselves?
So basically, what you need to understand is that when the AQI levels are poor, the only thing that can save you and your lungs and the overall health is that you have to restrict your outdoor movement to bare minimum possible. Move out only if it is essential, otherwise not. If you're moving out and you have an access and can wear an N95 mask, it will provide at least some protection. But please
Okay.
remember that most of your day is spent indoors, whether that is inside the houses, in your offices, in your
Mm.
uh, schools, universities. So in all that, you need to have your indoor air also clean. And for that, I think it's important to have probably now we've reached a stage where air purifiers, HEPA filters, that those are the equipment that you would want to rely on, or having green plantation inside also will help. Green plants also help in clearing up the air and
Yeah.
giving you oxygen. So that
Yeah.
is one. Second is that everybody should be taking the flu shot because at this time the flu vaccine also, sorry, the flu season also starts and lots of people start developing cold and cough. So flu vaccine is one thing that you should be doing. Keep
Yeah.
your indoors clean. There should not be too much of dust inside. So, wet mopping is a good idea rather than brooming. These are the simple steps that you can follow. And as far as diet is concerned, in diet, you should be having more of antioxidant rich food. So, more of in the vegetables, probably lettuce, spinach, these kind of things would do you good. Amongst the fruits, all kinds of berries, oranges, those things carry a lot of antioxidants. Then there are certain spices like your uh, then ginger. They are also rich in antioxidants. And of course, keep yourself well hydrated. That is very, very important.
Are air purifiers and N75 masks truly effective against fine particular matters and toxic gases?
See, there is nothing 100%, but whatever best you can, these are the only ways you can achieve. So, N95 mask will protect you only against the PM 2.5 particle, that too up till 95%. But any particle smaller than that, it won't be able to filter out. Toxic gases won't be able to filter out. As far as air purifiers are concerned, air purifiers would clear the air, but then again, it has to be a completely sealed room from all sides, only then. Otherwise, every time you open the door or the window, there's some exchange of air happening. So the poor quality air from outside will keep coming in and out. But then, as I said, when it is raining outside, you carry an umbrella, it does not protect you 100%, and yet you carry an umbrella with you, that at least there is some protection. So it's
Yeah.
just the same. You cannot recommend everybody and anybody to have air purifiers at home, especially in a low cost country like ours. But what we can certainly do is that people who are already vulnerable to developing these problems,
Hmm.
the vulnerable group like those who already have an asthma or COPD, at least they could keep air purifiers in their room at night when they're sleeping, for at least those 8 to 10 hours when the lungs would get adequate time to recover when their lung is not having to battle with the poor air quality.
Yeah. So, in the long run, how does constant exposure to Delhi's polluted air affect the lungs and heart? Even if this
So,
pollution goes away, like in a month or so, what all can happen due to this? How many days this pollution stayed?
if you recollect in London smog, there was a London smog that actually happened in 1954 from
Yeah.
4 December to 8 December, from a Friday to a Tuesday, when it was anticyclonic kind of conditions. At that time, their main source of energy was coal burning, and it was a chilly winter uh, days, those 4 days, during which they realized that there were 4,000 deaths that happened attributable only to the poor air quality. There was such dense smog at that time. And but later on, when they calculated, it was almost about 12,000 deaths and about a lakh of people who
Mm.
suffered a lot of damage to their health because of the
Mm.
poor air. So similarly, even now, I think the situation is no better that we see around ourselves. Air
Mm.
pollution has been labeled as the single most hazardous, toxic environmental risk factor to our health. It is
Yeah.
almost like a silent, invisible killer, but now it is visible to us also. You can actually see the poor air quality now.
Yeah.
Starting from simple things, as I said in the beginning, also that when you have a large particle, PM10 and above, they don't get filtered beyond the nose. So they basically result in cold, cough, watering of the eyes, heavy-headedness, sore throat, feeling like a foreign body sensation in the throat. Particles smaller than that, 2.5 and all, they go up to the lungs and cause an inflammatory cascade. A particle size less than 2.5, less than zero point 0.5 micron goes directly into the bloodstream and causes damage. So the
Okay.
actual damage occurs because of this inflammatory cascade that goes on into the lungs. And
Mm.
this inflammatory cascade then spreads into the entire bloodstream, into the heart, into the brain, causing damage everywhere. So, as far as lungs are concerned, you start with cough, cold, bronchitis, wheezing, asthma, COPD, hypersensitivity pneumonitis, interstitial lung diseases, lung cancer, so on and so forth. But when it comes to the inflammatory cascade traveling to the heart, it causes acute heart attacks, heart failures, can go into the brain, result in brain strokes as well. But the effect is not just in the adults, in children. Children develop very early on with their allergies, asthmas, respiratory tract infections, tuberculosis, so many other infections that become more common because of the poor AQI around us.
Yeah.
And of course, impact is also on pregnant ladies where the child is still in the womb and the child can suffer immense damage because of the poor air quality, resulting in poor lung functions, poor immune system, poor lung growth, and even premature deliveries.
Yeah. So, which specific chemicals and pollutants in the air pose the most dangerous threat to human health?
So basically, all of them, the particulate matter, PM 2.5 and below, and then
Hmm.
gases like carbon monoxide, ozone, sulfur dioxide, nitrogen oxide, ammonia, lead. So they're all there and all collectively cause a lot of damage.
So, how effective has the graded response action plan been in mitigating Delhi's pollution crisis year after year?
I guess this is something you'll have to ask an environmentalist, not
Hmm.
me. They'll be able to answer better that how effective have the grabs been. But I think at least any step towards
Mhm.
controlling the air pollution is most welcome.
Yeah. So, do you think the government is doing enough to control the pollution, like these cloud seeding, and how much will it help?
So I guess again, as I said, these are questions that you should be asking an environmentalist who will be able to do an analysis and tell you. I can only focus on the health impacts of the poor air quality.
Okay. So, thank you so much. Our
Yeah.
audience would be really happy to know all these details, and they must learn a lot from this interview. Thank you so much for your time.